I'm Brendan Cavanaugh, and I'm a cardiologist with IU Health Arnett, and I'm also the Chief of Cardiovascular Services, and I've been in practice since 2006. I decided to become a physician after an experience I had while working as an emergency room technician in Boston the year after I graduated from college. I vividly remember an evening shift where an ambulance came up to the ER doors and came crashing through, and one of the paramedics screamed, "This patient's in cardiac arrest." I watched the emergency room team skillfully transfer the patient from the ambulance bed to the hospital bed, administer medicines, and watched the emergency room doctor administer 2 or 3 shocks to bring the patient back to life. They called the cardiologist in an emergency to come and bring the patient back to the cardiac catheterization suite, and he put a stent in the patient's heart artery and essentially saved his life. It had a big impact on me, not only watching the care that was delivered, but after the event happened, the cardiologist came down, spoke to the family, made sure they knew that everything was okay with the patient, but came over to the team at the nurses station and looked at all of us and said, "Guys, this is why we do this." And that's the moment I knew I wanted to be a doctor. When you meet me for the first time, I'm always going to remember a famous quote that people may forget what you say, people may forget what you do, but they'll never forget how you made them feel. So my first opportunity to meet you hopefully comes with a smile and get you to smile. If I'm lucky, I'll get you to laugh. But it's an important time for us to get to know one another, so I'll ask you, what do you like to do outside of work? Tell me about your family. Tell me about the things that make you passionate about life, and we'll have a conversation. And after that, we'll talk about why you're here to see me, and I'll try to do my best to ease your fears and talk about a game plan to make you better. I want to make sure that when you're with me, you know that I'm not just treating your heart, but I'm treating you as a complete person. The thing I love most about my job is being part of my patients' families. I remember getting an invitation in the mail from 2 of my patients who are husband and wife, and inviting my family and I to a combined celebration of their 75th wedding anniversary and their 90th birthday party. And as my family and I were watching them up, talking about how much they loved each other in those 75 years of marriage, they turned to me and the husband said, "I want to thank my cardiologist for being here and to help us stay healthy and to keep us going." And I looked at my family and I said, "You know what? It doesn't get any better than this moment." And that was a special time for me. It was a special time for my family, and I'll never forget it. So when I'm outside work, I have 3 loves. First is my family, my 3 redheads at home. My wife says the red hair comes with a price, but I wouldn't have it any other way. The second is sports. I'm a rabid sports fan. I've been a Cubs fan all my life, and one of the greatest experiences of my life was being at Game 5 of the World Series. I'll never forget the energy, the smiles, the hugs. It was just amazing, and all of you who are sports fans understand what that is about. The last is music. I grew up in the suburbs of Chicago, and I became a big blues lover. And I used to go to see Buddy Guy play at his restaurant every January. And he'd have mystery guests every time we went. And we got to see Eric Clapton and Robert Cray and lots of different blues artists. And I felt privileged to be part of that as blues is slowly dying away. But I also love other types of music as well, but blues will always be my favorite.